Well, in truth, I think there are two bright ideas here. I think there are two in one. The first is that we're delivering a psychological therapy to a group of patients who've been, in a sense, neglected in the past. It began as a simple project within this COPD clinic, which is a chronic lung condition. These are patients who suffer very severely because of breathlessness.
And the second great idea is to transform this from what is at the moment one-to-one therapy into an online digital therapy that means that the patient can access this in his or her own time, in their own space, wherever and whenever they want to, and they can come back to it and repeat it and just feel comfortable with it.
So our bright idea is this. A really simple mask. It's a sleep mask. It's similar to the kind of thing you'd wear on an aeroplane, and you wear it at night. Now, you wear it while you're asleep, and there's a light that shines through your eyelid while you're asleep. The clever bit is in the science, and this version here, it's called an Octura 400. It's a treatment for a disease, a macular eye disease called diabetic retinopathy. Now that's a dreadful disease, and the cause of that disease is diabetes. So we've got a huge problem with an increase in diabetes, and a large portion of those people, over years, will develop this disease. So we worked out that if we could put energy into the eye in the form of a photon, we could prevent the dark adaptation happening in the first place.
So we're very much focused on X-ray detection, and we have a technology that's going to improve the quality of information that comes back from X-ray detectors used in medical radiography. Now, X-ray cameras have replaced film in medical radiography, so whereas before you'd go and have to sit in a wheelchair with a brown envelope with your film in, the images now are recorded on a digital camera, much the same as in your mobile phone. And these cameras really are limited in the amount of information they capture from the patient. And our technology enhances the amount of information that's available to the clinician, but also does it potentially with much less X-ray dose.
Okay, so what we're doing here is we're making a 3D printed insole, and what that allows us to do is it allows us to graduate the flexible properties of an insole. Common materials that are being used at the moment, like carbon fibre or EVA, don't allow for different flexes and torsions, and so by using 3D printing you're able to customise insoles much more and give opportunities to consultants to prescribe a much more clever device.